Welcome to the Chicago Psychology Podcast.
Well, I was first introduced to the device in 1990 while I was working in a comprehensive pain program at Miami Valley Hospital. And they were using it to treat chronic pain as well as depression, anxiety, and sleep disturbances. And I was just in awe of the results that I was seeing with patients who had either been injured in terrible motor vehicle accidents, industrial accidents, from any number of debilitating illnesses. The results across the board were amazing. And when I left Miami Valley Hospital, I brought the technology with me into another pain management practice. So I've been using this device in my practice for 30 years. Soon to be 31, used it very widely in Iraq and Afghanistan, even though in Iraq the use of the Alpha-stim devices was not sanctioned by the military. Thanks to the efforts of Dr. Kirsch, it rapidly became so, and now every deploying mental health unit in the combat theater has these devices on board, and all are very well trained in the use of it as far as both psychologists and mental health technicians as well as social workers.
Hello, this is Dr. Scott Hoy. That was the voice of Colonel Kathy Platoni. On this episode, I'm joined by her and Robert Kallus. Kathy is a licensed psychologist in Dayton, Ohio, and Robert is a licensed counselor in Valparaiso, Indiana. Kathy and Robert discuss the Alpha-stim medical device. The Alpha-stim is a neuromodulation device that is an effective treatment for anxiety, insomnia, depression, and pain. It has been studied in over 135 clinical trials and has been shown to be effective in the majority of users. We discuss the use of the Alpha-stim in their clinical practices, as well as Dr. Platoni's use of it with combat troops in Iraq, as well as her research with first responders in Ohio and Texas. We also cover her work on helping the device get approval from the FDA. I'm sure you will find this to be a fascinating talk about a little device that is helping a lot of people. And now, here is the interview. Well, thank you for coming aboard, Kathy Platoni, Dr. Platoni, and Robert Kallus. I appreciate both of you for coming on board, both of you to talk about cranial electrostimulation of the brain to help with depression, anxiety, PTSD, possibly some other things like OCD, and pain management. Insomnia, yes. Pain management.
Don't forget insomnia.
A host of things. So this is kind of a similar device to like TMS, transcranial magnetic stimulus, which is another electrical way of a fairly non-invasive way of working on stimulating regions of the brain electrically so that the brain functions better and people's mood abates or becomes more improved and they're able to think more clearly and lead better, more fulfilling lives. But with that little introduction, can you tell me both how you became involved with using this device in your practices, and maybe Dr. Platoni, you could let me know specifically how it's being used in the military, because I know you were a military psychologist.
Yes. Well, I was first introduced to the device in 1990 while I was working in a comprehensive pain program at Miami Valley Hospital. Mm-hmm. And they were using it to treat chronic pain as well as depression, anxiety, and sleep disturbances. And I was just in awe of the results that I was seeing with patients who had either been injured in terrible motor vehicle accidents, industrial accidents, from any number of debilitating illnesses. The results across the board were amazing. And when I left Miami Valley Hospital, I brought the technology with me into another pain management practice. So I've been using this device in my practice for 30 years, soon to be 31. Used it very widely in Iraq and Afghanistan, even though in Iraq the use of the Alpha-stim devices was not sanctioned by the military. Thanks to the efforts of Dr. Dr. Kirsch rapidly became so, and now every deploying mental health unit in the combat theater has these devices on board, and all are very well trained in the use of it, as far as both psychologists and mental health technicians, as well as social workers. So everybody knows how to use it, and it's now being used in every Army medical center throughout the United States and the combat theater. I cannot speak for the Air Force. I believe most of the major Army Air Force medical centers are using the device also. It's even being used in aeromedical psychology at Fort Rucker, Alabama, for training of helicopter pilots and crew.
Mm-hmm. Wow, okay. To reduce anxiety while on mission, or just in general?
Yes.
Okay, wow.
And to help with sleep disturbances, as well as depression in lieu of medications. So it's being used for anything and everything, very, very widely in terms of anxiety, insomnia, depression, PTSD, and pain.
Wow. Okay. Well, tell us a little bit about, maybe if you know some of the mechanics of it, some of the research and the experimental literature on that, if you know any of that.
Certainly. Well, it is the most researched medical device of its type anywhere in the world. What it does is it increases the production of alpha waves in the brain, and alpha waves are associated with deep calm, deep relaxation, increased mental focus, and increased mental alertness. The research is considerable. I'm not familiar in particular with all of the studies, but one study I'm very familiar with because I was involved with it recently, and the results were extremely promising. Last October, we, through the efforts of Dr. Dan Kirsch and Tracy Kirsch, president of Electromedical Products International, we started a first responders program here in the Dayton, Ohio area. They had already started one in Mineral Wells, Texas for their first responders. We asked for volunteers, and we got 100 officers to accept these devices for free in exchange for a 6-week research program that was conducted with the use of an app, so they could record their symptoms and their improvement with each of the symptoms that they had initially indicated they were experiencing, both on and off the job. And they were able to keep the devices in trade for filling out this app for 6 weeks. And I'm still seeing many of those officers who initially received those devices last October, and the results have been amazing. And also recently, we've had a number of terrible tragedies here in the Dayton area. We had a mass shooting on August 4th.
My condolences for the Dayton community are extended. What a horrible situation. And you've been involved with the first responder units with that?
Oh, absolutely. Within 2 hours of the shooting, I was on the ground dealing with both police and fire in terms of doing critical incident stress diffusings and debriefings, and seeing each officer involved. In fact, I'm still seeing many of the officers who were involved in that shooting almost 2 months out. They were also given devices due to the generosity of the Kirsch family, so they are using them regularly and using the app as well. Interestingly enough, just before I got on Skype with you, I spoke to one of the officers who was involved in the shooting, and he was in a pretty horrific motor vehicle accident last night while on duty. 2 officers were pretty seriously injured. They were hit by a car full of teenagers going the wrong way over a bridge. It's fortunate that nobody ended up in the river. And after the conclusion of our phone call, he was going right for his Alpha-stim device because he's in some pretty serious pain right now.
Okay. And is he using a particular? Does he have? I know there's 2 different Alpha-stim devices. There's the M and the AID version. The AID is one.
He is using. I'm sorry. Go ahead.
Oh, the aid is used for mental health alone, and the M is for pain management. Which one is he using?
He is using the aid because, interestingly enough, it does stimulate the release of your own natural opiates into the bloodstream. It doesn't have the same effect or as strong an effect as the Alpha-stim M, which is indicated for chronic pain, but nevertheless, it does have a considerable impact.
Wow.
So he's home using it right now.
Oh, very excellent. So, would you say that for, the difference for the audience, in case they don't know, chronic pain is for long-term, I believe, over a 6-month period post an accident or an incident, or post the start of something like fibromyalgia. And this would be more acute pain that he's currently experiencing and using
Correct.
the device for. Have you seen chronic pain also just be alleviated or reduced considerably with the help of the aid device alone?
In some cases, yes. But if the pain is extreme, for instance, terminal cancer pain for people who have reached the end stage of life, it's not going to have the same effect as it would with somebody who has, for instance, multiple sclerosis or muscular dystrophy or degenerative disc disease. Those people tend to do very well, even with the Alpha-stim aid.
Okay.
Even though that's not specifically indicated for chronic pain, does have somewhat of an impact, particularly with regular use.
Wow. Okay. Wow. Excellent. Okay. So working with the first responders, you're seeing, it sounds like from the study you've done, has the study been complete and has been published?
Yes, it has been published. And in fact, if you will give me a second, I will go get my copy of the study.
Oh, excellent. So while we're waiting, Robert, do you have any thoughts or comments?
I do, and absolutely confirming what Dr. Platoni, also known as Colonel Platoni, has said. She's the one who introduced me to the technology about 7 years ago. And I'd just like to report, to kind of fill in some area where Kathy did not check in on, some of the reports that I've gotten from clients, almost verbatim. I'll tell you what people have told me. And I'm quoting or paraphrasing what they said. For example, they'll say, I feel lighter. I feel as if a weight has been lifted off my shoulders. I feel grounded. I've had people come in with a headache and leave with no headache after using the Alpha-stim. I have heard people say in numerous cases, my mind has stopped racing. I feel grounded. I don't feel like I'm all over the place anymore. I worked with a teenage boy who had committed a lot of violent acts while in residential placement when I was working there, or that had been prior to his placement, of course, out in the public. He had perennial sort of stomach tension due to displaced anger from a very troubled childhood, and he responded immediately to the technology. Muscle tension goes away very quickly, almost immediately for some people. Some people say it's like a fog has been lifted. I'm seeing a little more clearly than I did. And one of my notable clients who had been suffering from insomnia for years and was taking one of the well-known habit-forming prescription drugs for it, used the Alpha-stim one fine day in my office. She came back 2 weeks later and said she has not had to use the medication once. She's been sleeping like a baby. And she was actually
did she have the
first client.
Did she have the device at her home and use it in replacement of an anxiolytic?
No,
she just had one session?
That was single use in my office. And she came back 2 weeks later.
Mm-hmm.
She ended up buying her own unit. She was my first client, actually, who bought her own unit directly from me.
Okay.
And at this point, I believe I've counted something in the area of 16 or 17 clients who've bought their own units, and they're extremely happy. Now, one thing also that ought to be known, it's a very small device. It's about the size of a cell phone, as you know. And it's got a belt clip on it to allow the user to be to attach it to their body while they're going about their business. So they might use it for a 20, 40, or 60-minute session once in a day or even twice. And you can do just about anything other than heavy exercise, certainly not getting it wet. Do your ordinary business, work around the house and so forth, and it continues to operate. And not only that, but I have found marvelous results in use of guided meditation while the client is using the Alpha-stim.
Yes.
As well as hypnosis. Isn't that right, Kathy?
Absolutely correct. Yes.
So you can use it
double whammy.
So you can use it in conjunction with hypnosis. Now you mentioned alpha waves, and for the audience, the brain produces 4 types of waves: beta, alpha, theta, and delta. And typically, it's been recorded that before and during hypnosis, people in that process, and probably in mindfulness studies, the brain is actually producing more of those alpha waves and maybe some theta waves, depending, probably more so in hypnosis recordable, because the hypnosis tries to work more with the person's unconscious more directly rather than indirectly, like in the case of something like guided imagery or meditation. But what you're saying, and as a person who uses hypnosis in their practice, you're saying it can kind of deepen or more profoundly affect the hypnosis or the mindfulness or the guided imagery?
Well, my experience is similar to what you just mentioned a moment ago, Scott, and that is that in deep hypnosis, it's this theta wave that is operative primarily. Mm-hmm. And since the device is designed to generate and stimulate the production of alpha waves, I wouldn't necessarily say that it's recommended, although it certainly won't hurt any, to try and do a hypnotic session while the client is using the Alpha-stim. However, and as we know from the Chicago Society of Clinical Hypnosis meeting that we had on mindfulness and hypnosis, there are a lot of touching points between mindfulness meditation and hypnosis. And as I've observed, and I think Kathy just confirmed a moment ago, simply allowing the person to use the Alpha-stim while they're doing breathing exercises or doing some sort of visualization a la guided imagery is a marvelous combination. So I think that's about all I'm going to offer. I think Kathy's done a terrific job. She's incredibly knowledgeable about this.
I wouldn't go that far. Thanks, Bob.
I'm a believer.
I would agree. Yeah, I would agree. It sounds like you're back, Kathy. Do you have the study that was published?
I do. This was published, let's see, in May of this year.
Okay, very
actually,
current.
the publication date is July 7th. It was published in Jacobs Journal of Psychiatry and Behavioral Science, and the title of the article is First Responder Research Shows that Electrical Brain Stimulation Helps Control Anxiety, Insomnia, and Depression. And the purpose of the study was to investigate the effectiveness of cranial electrotherapy stimulation, and this assessed perceived levels of anxiety, insomnia, depression, and pain. And the results showed that Alpha-stim CES technology reduced anxiety, insomnia, depression, and pain symptoms across the board on an 11-point rating scale. So the Cohen's D values were large for all outcome measures, indicating a high level of practical change from baseline to post-test. So, and we're talking about a population routinely exposed to a tremendous amount of trauma, cumulative trauma. Mm-hmm. So results were very, very positive.
Okay, excellent.
By the way, numerous studies have been done.
Yes.
The website indicates that something in the area of 95 separate randomized clinical trials have been done with thousands and thousands of subjects in the experiments, mm-hmm. and virtually no side effects. I just want to jump in with one more thing. We use the word electrotherapy, cranial electrotherapy stimulation. It should be important for people to realize that they don't feel electricity when the device is operating. They don't feel a current, as you know. What they feel is just a feeling of niceness, a calm, a euphoric feeling of well-being. And so people need not be concerned that this is a brain zapper or that it's dangerous in any way. There are some contraindications. It seems there are some people who probably should not use it. My understanding is studies have not been done on pregnant women at this point. That I don't know if that's still true, Kathy, but the last time I talked to Jeff Mark, so it may be safe, but we don't know for sure. And my understanding too is that subjects who are equipped with a pacemaker in their heart ought not to use it as well.
Correct.
So yes. Otherwise, it's perfectly safe. And by the way, the website for Alpha-stim, www.alpha-stim.com. Mm-hmm. There is a ton of information on this beautifully designed website.
Okay, we'll definitely
alpha-stim.com.
We'll definitely post some links in the show notes on the website. Just to kind of go back here, is it important for a person to make sure that they turn off or remove the amplitude for a TENS device or some sort of implant for pain while they're using the device?
Oh, that's an excellent question. I don't think so. I have a number of patients who have implantable pain-relieving devices, and they use the Alpha-stim as well.
Okay, and they don't like. I know with sometimes with Bluetooth biofeedback devices, it's important to turn off. It's contraindicated for like a pacemaker, I think, in some cases, and definitely for a TENS device. Yeah. Okay.
I would just recommend that they do turn it off, just in case there's any combination of effects that may not be in the best interest of the patient. I've never seen that happen. I just think that's a good habit for the safety of the patient. I have never seen anybody have any side effects as long as they don't have the current turned up past. I recommend that they keep it at an amplitude of no higher than 300 microamperes. Most people use it at 100 or 200, but you have to realize it's 1/1500th as intense as electroshock therapy. The two are completely and absolutely related.
Well, I would hope so, because I don't think that would be something you could control for in your office outside of a medical setting. And that's a lot of electricity, too.
Yes. I tell patients more is not better. Don't turn it all the way up. It's supposed to be subsensational. You're not supposed to feel anything except better and wish that, wow, I wish I could feel this way all the time.
Well, okay. Sometimes people might feel a slight, I think I've seen on the website, sometimes people might feel a little bit of vertigo, but when that happens, are they supposed to turn the device down a bit?
Yes.
Yeah, that's right.
Okay.
And there are some people who don't get anything out of it. I've tried it for myself. I'm in that small group of 15 or 20% of people who do not benefit from the device. And the percentages in my work match up, I think, very closely with the percentages in the randomized clinical trials, which is that roughly 80 to 85 people out of 100 will derive benefit from anxiety, depression, and insomnia.
Wow.
Now, the thing about depression is that it does need to be used regularly, daily, for a minimum of generally 2 to 3 weeks in order for depression to lift. But for 80 to 85% of people, anxiety and insomnia will receive some measure of relief virtually the same day.
Okay. Wow, that's pretty amazing. I mean,
yes, that's been my experience as well.
Well, what about the use of the device since the opiate crisis is still upon us, and it just seems to be a unfortunate never-ending story? Has this been shown to reduce the use of opiates for pain management or other psychotropic meds?
My understanding from the research that I reviewed, of course, it's been a long time since I reviewed that research, but my understanding and my experience is yes.
Okay, wow.
There's also some research, I believe, that's on the website demonstrating the use of cranial electrotherapy stimulation in the treatment of addiction and substance abuse.
So in other words, reducing the anxiety, depression, and mood issues that happen to probably be the precursor to the addiction behaviors and the substance use.
Yes.
Wow. And so there's, you don't feel so stressed out. Why would you need to drink? Yeah.
There you go.
Yeah. Okay. Wow. Okay. That's.
I'd like to add another benefit, if I might, Scott.
Mm-hmm.
Unlike the use of medications, which operate on the chemical workings of the brain, the use of the Alpha-stim actually improves the benefit of the Alpha-stim. The power of the healing improves the more you use it. With medications, whereas psychotropic medications have been proved to be effective for lots of people, for a number of different maladies. For many people, a tolerance is developed for the medications, and oftentimes the client or patient has to return to the doctor for an adjustment or a change in medications, an increase in some cases, and that's exactly the opposite of what Alpha-stim does. In short, the more you use it, the better it works. And not only that, but if a person is suffering from depression or anxiety and wants to sort of have a safety net and continue to use the medication, what the research shows is that using the medication and using the Alpha-stim concurrently potentiates the effect of the medication. So that theoretically, since it makes more powerful the impact of the medication, and when you're using the Alpha-stim, you can reduce the dosage.
Wow.
So this can help people. People can help get off of their psychotropic meds theoretically and in fact by the use of the Alpha-stim. Now, for some of these people, they're going to have to use it every day or at least every other day. And because every case is unique, we can't predict, we can't make unfounded claims. But the research is pretty conclusive, nevertheless.
Okay. Yeah, I mean, there's a host of it's been studied for 40-some years. Well, Colonel Platoni, sorry I didn't call you Colonel before.
Colonel, Doctor, it's all the same.
Just we won't call you late for lunch. How's that?
There you go.
All right. I guess there's a bit of a backstory here. You actually testified before the FDA at one point. Is that correct?
Yes, I did in 2012, the FDA Neurological Devices Panel.
Wow. And tell us about that.
Oh boy, it's an experience I would never want to repeat.
Well, these are doctors, right? They're nice people. I'm being facetious, of course, but yeah.
These were not nice people. It was truly
okay.
amazing to see these, well, in their own minds, I guess, highly respected physicians who were on this panel to be doing things like sticking their tongues out at us and making faces at us and rolling their eyes at us. I'm not kidding. It was really that bad, cutting us off in midstream, refusing to listen to the research. They actually called the police to remove one of the psychologists. I'm sorry, what was it? I remember if it was a psychologist or a patient. I believe it was a retired psychologist who was trying to give his testimony about the effectiveness of this device, and they called the police to have him removed from the room. Wow. It was that bad. In addition, they made this absolutely outrageous claim that it increased the frequency and intensity of epileptic seizures in a patient. Mm-hmm. This patient had seizures before she started using the device. They claimed the device caused the seizures. I mean, they fabricated, they lied. It was just egregious.
Well, was there money to be had by the patient who had the seizures probably before the initiation of the use of the Alpha-stim device?
Yeah, it's called kickbacks from Big Pharma.
Okay, yeah, that's big money. Well, it's not much
yes,
money.
It is.
It's not much money. I worked on a big case that eventually for a painkiller that eventually became a class action suit. I won't mention the product or the company or the law office that I worked at when I was doing legal assistance and paralegal work, but years ago. But they were able to spend $58 million a year on a particular product to keep it from going class action as long as possible, because they were making $2 to $3 billion, probably more, off of it. So it's wow. A lot of money there. So giving somebody, $1 million would be really nice to keep other things going. Well, you said I don't necessarily want to go into conspiracy theory territory, but you say the pharmaceutical companies they were basically trying to keep this device from being used?
Well, I can't say that the pharmaceutical companies, but the physicians on this neurological devices panel didn't want, I can't remember the class, if it was 1, 2, 3, or 4. I would have to look at the results or the findings from the panel, but they were trying to prevent the Alpha-stim devices from being FDA cleared for use by the general public by prescription. By the way, it's over the counter in Europe and Asia.
Okay. Well, now to kind of segue, because we only have a limited amount of time for the call today, and there's so much interesting information about the device and its history and whatnot. The Alpha-stim is one particular device that creates this electrical current, and it has what I've seen from the website, a patented sine wave for the electrical stimulation. Is that correct?
Yes, it's a patented waveform, yes.
Okay. And so that waveform's patented, but other devices, I will not name other brands, but there are other brands out there for around the same amount of money, maybe $100 less. Is it? Am I correct in assuming that the Alpha Wave product or the Alpha-stim product was first, and that other things have been kind of based on that patented waveform?
I believe you are correct. And the other devices, and we know who they are, do not stand up in the research.
Pardon me, excuse me for jumping. I don't mean to be rude.
It's okay.
I'll jump in whenever you guys are done.
No, please go right ahead.
Well, just sharing a personal anecdote from my practice. A client of mine was interested in the device, but apparently they're money conscious, And looking around, they thought they would find something that would cost less than the purchase price of the Alpha-stim because they wanted something for themselves, seeing that was benefiting them in our sessions. And so I had one client who said she found this device that was less than half. The cost was less than half, and it was coming from another country. I won't say which country, but very close to us. And she gave me the name of the company, and I actually called them. And I inquired about their device and the research behind it. And in effect, what they were saying was that their device was covered by all the other research that had been done on this technology.
Oh, they were cutting and pasting.
They hadn't done their own research.
So it was a cut and paste. Okay, good.
Yeah. And not only that, but here's a real problem. They're not regulated.
Oh,
they don't have to pass the FDA. They don't have to do anything except make a device that they say works.
Okay.
So there's that. And then one more thing to think about. It is possible to look for this device elsewhere other than from the company that manufactures and distributes it, which is called Electromedical Products Incorporated or International Incorporated down in Mineral Wells, Texas. If you happen to find one for sale, for example, on one of those online vendors like, say, eBay, for example, do not do it, because either it's a knockoff or it's a lemon. Regardless, you're not going to be covered by the warranty.
Okay.
Yes.
It's very important to buy it from the company that makes it and from a licensed therapist that you're receiving the services from. You get the warranty, and I will tell you this, Electromedical Products International is just wonderful to work with. I've had one situation, in fact, the very first unit that I bought, I forgot to register it, had a problem with it about 2 or 3 years after I bought it, and they said, don't worry. Now, I don't know if they'll be as nice to everybody else, but they were.
Yes, they are.
They were very. Thanks. That's good to hear.
Okay.
They were great. They said just send it in.
Okay.
We'll believe you, and we'll send. And they sent me another one. No questions asked.
Yep.
Okay. Well,
So it's a really awesome company.
okay.
It really is.
Awesome. Well, I kind of segueing back to the research a little bit, and that's good. It's good to know for the sake of the consumer and the practitioners that information, because a lot of companies aren't so kind to the people who purchase their products. But getting back to the research information, one of the some of the research has been in obviously in brainwaves post-session, because you can't do the EEG device in conjunction with the Alpha-stim being on the person's earlobes, which is where it's clipped. But some of those studies, at least one of them, talked about how some of the deeper cortical centers of the brain are affected by the stimulation of the cranial nerve, and that the default mode network showed some shifts and changes in it. And now the default mode network is a term that's being used a lot for kind of the set point or the resting point of the brain that's implicated in personality and wellness and dysfunction. And it's also being kind of talked a lot about with regards to the new psychedelic psychotherapies. So especially in psilocybin research, it's been hypothesized that what the use of psilocybin does in psychotherapy for PTSD or depression or anxiety, end-of-life depression, is that it kind of reboots the brain chemically. So there's a cascade of serotonin all throughout the brain, and it discombobulates a person. Pretty much so. If for any of those in the audience who might have recreationally use psilocybin or mushrooms or something like that, you are in the know, or if you've been involved in one of the studies that's been done recently. But these same regions, or some of them, and especially the default mode network, is involved in this Alpha-stim device. And I just thought I'd throw it out there because I thought it was pretty fascinating to see that term. Maybe it's kind of a fanciful term to use now amongst neurological research, but it seems like it is pretty solid research, and it seems like there's kind of a connection of what's going on with this kind of electrical stimulation versus the use of a psychedelic in therapy.
Well, I guess they have their place for those who follow Timothy O'Leary.
Well, no. I wouldn't say that. If you actually look at the research now, Johns Hopkins and the Hefter Institute and a number of places, they're at third stage clinical trials, and it's being fast-tracked by the FDA. So those will be out there.
I do have.
But I wasn't. Yeah.
Yeah, you're absolutely right. Yes.
Yeah. So I wasn't bringing it up to say yes or no to them, but just the fact that the default mode network has been discussed in some of the research literature for CES, cranial electrostimulation, and psychedelic therapies. I didn't know if you had any information about that, or if you had any comments about that. That's why I was kind of bringing it up.
Well, I in one of my patients, I don't have any research to substantiate this, but one of my patients with severe PTSD is using psilocybin, and it has had some short-term results.
Okay.
I also have a patient. Oh, sorry, go ahead.
Well, I'd be curious as to how they're using it. If they're using it microdosing, or if they're having the session, like having sessions for PTSD with an actual group that's part of the FDA studies.
No part of any FDA study, just microdosing.
Oh, okay. Yes. And that's not what this is about. But the microdosing has, because it's a medicalized dosage. I don't want to segue too far, go too far a trail from what we're talking about here. But with regards to the psilocybin research, it's a certain amount of micrograms per kilogram of body weight up to a certain point.
Yes.
Yes. And that is different from microdosing, which if it's not an actual psilocybin pill, then which it probably isn't, it's more than likely taking a few mushrooms, which you don't know how much psilocybin which is the active ingredient in the magic mushroom. You don't know precisely what you're getting, and it's different, and it's slightly changing your perspective rather than rebooting the computer of your brain, turning it off or kicking it, if you will. So it's different. But I'm sorry to interrupt, Colonel Platoni. If you can,
no, you're
go
fine.
Ahead. Okay. So it was some limited effect with microdosing. But what was the other case you were going to talk about?
Well, this is not a hallucinogen, but one of my patients is using Spravato, which is one of the ketamines, I believe.
Oh, okay.
For treatment of very, very resistant depression precipitated by not only cardiac arrest during surgery, but something like 30 ECTs. Yeah. And because that completely destroyed her memory, the depression followed very quickly. Well, guess what? The Alpha-stim is the first thing besides the Spravato, which is injected or inhaled ketamine. As I understand it, I am by no means an expert in that at all. The Alpha-stim and the ketamine therapy seems to be literally reversing her depression into some mild euphoria after 3 years of struggles.
Oh, wow. Yeah, and there's a lot of post-operative, having done rehab psych, there's a lot, and you know this, both of you probably know this, there's a lot of post-operative depression, especially when it comes to heart surgery.
Yes.
Yeah. Wow.
That's true. This is true. Interesting studies from Lancet, the British Journal of Medicine and Medical Research, regarding the use of exercise to reduce depression symptoms after heart surgery. Obviously, exercise supervised by the physician. Good research on that as well.
Yes.
Well, I know that using diaphragmatic breathing, because I use heart rate variability biofeedback, one of the modalities I'll use in my practice, it is
Wonderful.
connected with vagal tone, and the vagus nerve is a cranial nerve, and so that is probably implicated in exercise, although you're moving around, so you're not quite noticing the euphoria you might get from minute to 2 to 5 minutes of controlled, sustained by a diaphragmatic breathing. But there must be some kind of connection to how that reduces anxiety and the stimulus of the cranial nerve via electrocution? No, by electricity stimulus. Sorry, Dr. Freudenstein was slipping out for a second here. No, we don't no one electrocutes anyone. But anyway, there must be some connection between the two. I haven't really had a chance to look up any of the literature, but I'm sure there's some out there, and it seems to make sense since you're.
Well, it certainly would, and you'll find out too that Jeff Marksberry, who's our consulting physician at Electromedical Products, he is a treasure trove of information. He's an MD, and he's a great person to talk to, always available. So I think he'd be a good go-to on this question of whether the Alpha-stim.
Jeff has actually just very recently left EPI. I believe his replacement is Dr. Josh Briley, who is a psychologist and not a physician. And Jeff is, Josh is just getting geared up with EPI in terms of conducting research and becoming very familiar with the previous research. So recent change in venue there.
Okay. That's good to know.
Yeah. Well,
regardless of his, go ahead, please.
No, go ahead.
Oh, one more thing, if I can jump in. Scott, as you know, I've begun recently to use EMDR, eye movement desensitization reprocessing, to help clients with trauma issues. And I've noticed that using the Alpha-stim while the client is doing EMDR therapy with me is also another great benefit.
Okay.
So there's another bit of another piece in the puzzle that people might, if they know something about the various forms of trauma treatment, such as EMDR, that's good info too. So any therapists listening out there who actually are doing EMDR already, if you were to add Alpha-stim to your quiver, what a difference you could make, even over and above what you're already doing.
That is an invaluable piece of information. Thank you.
Yeah. I think what have you noticed? Excuse me. What have you noticed, Robert, regarding like the difference between using the Alpha-stim with any particular patient, perhaps, or maybe several, with the EMDR? Do you use it during? And it seems to me if you're helping produce that more relaxed state, it's going to help the EMDR to process the trauma.
What happens typically, and I don't have a really large sampling to report, so I'm not speaking from the standpoint of an accomplished researcher, but anecdotally what I've noticed is that clients who have anxiety and will respond to the Alpha-stim in a matter of minutes are able to focus better. EMDR requires the subject to focus on a traumatic memory.
Yes.
something that people don't want to do.
Mm-hmm.
So the Alpha-stim helps them to, not only that, but to maintain a homeostatic state of calm and balance and a sense of being in control while they're addressing their traumatic memories.
Okay.
That's again anecdotal. I don't have measures on this. I'm only reporting what I've observed over the last year.
Well, I mean, that's not, you don't want to throw it away just because it's not a randomized controlled trial and it doesn't meet that gold standard of outcome studies, but or efficacy, but it's effectiveness you're looking at for an N1 or N of 1 study, and that's okay. You're still you have to make a hypothesis, assess, figure, based on the hypothesis and or base a hypothesis on an assessment with a patient and you're or a client, and you're working, you're working as a scientist, but in a clinical setting. So. No matter what the letters are after your degree. So it's basically like one way to, in a nutshell, is this particular device, the cranial electrical stimulation, is kind of working to entrain the brain into an alpha state, work on the brainstem, I think is what's implicated, and their studies have shown that serotonin's increased afterwards, opiates, and it's kind of like you're doing the same thing that hypnosis or mindfulness might provide a patient over, kind of gently walking them into that state, but you're kind of doing it from a bottom up versus a top down. You're working on afferent neurons to stimulate the nervous system in the brain versus efferent. What does that make sense? You're kind of like
you're talking about my pay grade, Scott.
Yeah.
Well, you're working. You're basically you're stimulating the body.
40 years ago.
All right.
Yeah.
Well. All right. Maybe I should take up lecturing at a university or a PsyD program instead. But as far as it's kind of what you're doing. You're forcing a nervous system and the central nervous system to go into this state, which releases a cascades, or perhaps chicken or egg, two sides of the coin. Does the serotonin create an improved mood, or does an improved mood create the serotonin? We don't know. If you look at kind of a ridiculous analogy, but if some people like to look at kittens on YouTube and they feel really good, and puppies, and then they stimulate their brainstem that way, and you can do it the other way around if you have difficulty with kitten or puppy videos, I guess. I'm trying to use. Okay, maybe I should go into stand-up now. I don't know, but I think I'm trying to put it into basic ideas for the general audience to pick up, or for people who don't want to go back to cognitive bases of behavior or something like that. Anyway, so well. Is there anything else? I think we're just about out of time here because we do have a set time.
Back to work.
Is there anything else we should include or conclude our conversation? Thank you, by the way, for stopping by, for reaching out to me.
Well, you're more than welcome. I can't think of anything else at this point. How about you, Bob?
Well, I just want to thank Kathy for introducing me to this amazing technology. We happened to run into each other. I think it was on the online listserv for hypnosis.
Yes.
And I kind of puzzled over this for about a year before I decided to take the plunge and buy the Alpha-stim units. And it's one of the best decisions I've ever made for my practice. So I'm thanking you and give my eternal thanks to Dan and his family.
I will
Dan Kirsch, the neurobiologist who developed this incredible technology. And if I were king, every therapist who works with people who have anxiety, PTSD, depression and insomnia, they would be commanded to use this unit. But
Well,
unfortunately, I'm not.
well, yeah. I mean, civilians. It sounds like every civilian therapist could be using the same thing, because you just basically said, if anybody suffers from a DSM, most of the DSM disorders, you should be using this device.
There you go.
Yeah. I mean, it sounds in light of we don't want to make a panacea of it or be silly about it, but you basically are saying it's kind of has a general application for everyone.
It does.
Yeah. Okay. Wow. Okay. Well, on that note, I shall sign off with you. Thank you so much for coming on board, and
thank you very much for both of you for organizing this.
Well, okay. Well, it is our pleasure here. Both Kyle and I appreciate it when people can take the time out to be on the podcast. So, and thank you so much.
A pleasure.
Thank you. Okay. My pleasure, my honor.
We hope you enjoyed the interview. Since speaking with Kathy and Robert, I have integrated the Alpha-stim device into my own psychology practice. I have seen a number of positive effects with pain management, anxiety, and depression in my office. And a number of my patients have been so impressed with its effects that they have decided to purchase their own unit for home use and have received great results. On a personal note, over the last Thanksgiving holiday, I was able to apply the Alpha-stim M device with my sister. She has given me permission to report the results and what ensued. My sister suffered from a crushed ankle in 1976 and has had a constant pain in that ankle, ranging from 6 to 10 on a 10-point scale for the past 42 years. In other words, she has never had a day without pain. She has had a 50% range of motion in that ankle. 2 orthopedic surgeons have told her the only possible means of fixing it would be to fuse the joint. And this, they told her, was not a guarantee to reduce her pain or eliminate it. The day before Thanksgiving, I used the Alpha-stim device with her. After a few passes with the wands that are part of the M device, she reported a significant drop in her pain from 2 to 10. That evening, we again used the Alpha-stim device. Afterwards, she reported no pain in the ankle. She has since purchased a device for herself and has used it daily to keep her pain very low. On most days, she awakes with no pain, and it remains that way for the rest of the day. She has also noticed improved sleep due to the pain being greatly reduced. Now, I'm not trying to sell this device to you, and I'm also not a paid representative for the Alpha-stim company. It also might not be to your liking, but I do believe that it can be an effective tool for the majority of medical and behavioral health specialists, and would recommend professionals and consumers looking into using it. I would like to emphasize as well that though it can have positive effects on the physiological mechanisms of mental disorders and pain, it does not change the meaning of our lives or the choice of goal-directed behaviors. It does, in many cases, help to lift the physical fog, so to speak, of anxiety, pain, and depression. This affords a person more choice to look clearly at their lives and the people in it. So to this end, it can help a person to get a better view of the landscape or map they have constructed of the territory of their lives and make clearer choices. So, much like medication management, it does not work to replace the effectiveness of therapy, but it can enhance it. On a final note, I have recently received word that the device has been approved for a CPT code for billing purposes for Medicare and Medicaid. This means that the private insurance companies will follow at some point. Appreciate you tuning in. Please do us a favor and listen and give us a great review on your favorite podcast streaming service. It would help us out immensely. This podcast is for entertainment and informative purposes only. If you need a mental health professional, please seek one out. All material copyright 2019, the Chicago Psychology Podcast. Music is provided by the band Serenati.